As we all know, every hospital today has to face the challenge of resilient superbugs and costly outbreaks. Now imagine achieving a uniform and consistent outcome every time you disinfect, disinfecting all equipment and high and low touch points effectively every time, knowing that no zone was missed due to human error, all while allowing your institution's environmental services and infection control staff to use their time and resources wisely without compromising the outcome. Achieving these goals is the objective behind the Nocospray system. It was created to allow efficient, automatic disinfection of all exposed hard surfaces in a room, including the high and low touch points and the equipment present. The system consists of two parts: the Nocospray machine and the Nocospray disinfecting liquid. These have been developed and scientifically calibrated to provide powerful results when used together. Consider that to eliminate or even reduce the presence of spores such as C. difficile, the sporicidal disinfectant must be active, meaning wet, and in contact with the surface for the entire contact time described on the label. For most sporicidal disinfectants available today, this means keeping every single surface in the room wet for at least 10 minutes. It would take a large amount of staff many hours to effectively disinfect an entire room to these standards, let alone without missing an infected spot. In contrast, the Nocospray system is disarmingly simple for just one person to use. Just set the machine according to the room size and target pathogen, then press the start button and exit the room. Moments later, the Nocospray's ionizing turbine begins to disperse Nocospray as a dry gas. As that gas fills the room, it permeates every exposed area. The system is designed to dose the correct amount of Nocospray for the setting, and then automatically shut off. The room is then left for the necessary contact time, after which it is ready for use again. Nocospray is ready to use with no dilution required, and is correctly dosed by the machine to treat an entire room, greatly minimizing the risk of human error. And because it leaves no residue and is over 99% biodegradable, it is safe for staff and patients. Another compelling advantage over traditional liquid hydrogen peroxide-based products is that as an ionized gas, Nocospray will not cause corrosion. Although the Nocospray system is new to North America, it has already been used effectively in Europe, Australia, the Middle East, and Asia for over 10 years. It is important to note that to be approved by Health Canada for healthcare settings and to receive a DIN, Nocospray had to show it is effective as a sporicidal disinfectant when used as part of the Nocospray system. This required clinical proof that the system can achieve a 6-log reduction of various spores, including C. difficile. In other words, the system killed 99.9999% of the spores present. The system achieved this result when tested against the spores of arguably the most resilient C. diff strain, the infamous NAP127. It is also worth noting that these tests were conducted in a real hospital room and not in a lab. This allows Nocospray to help you set a higher standard for managing and preventing outbreaks, especially in high-risk areas and rooms where infections tend to recur, for terminal cleaning of patient rooms, for disinfecting bathrooms and bathing areas, and daily disinfection of equipment rooms. When used as directed, this system will help prevent and reduce outbreaks within healthcare settings, or in any enclosed space challenged by pathogens such as influenza, MRSA, or C. difficile. Nocospray is disinfection, simplified.